Okay, well, welcome everyone to the WELL panel on women's leadership in digital behavioral health. I'm Dr. Clare Purvis. I'll be moderating today's discussion, and I'm the founder of WELL. So I'll just start with a little bit of context about who we are as an organization and then introduce our panelists. WELL is a women's leadership organization that serves clinical health scientists of a variety of backgrounds in digital health. We really exist as a forum to support women clinicians in driving leadership in digital health and stepping into greater impact as strategic and clinical leaders in this space. Our panel today is going to explore some of the experiences of women leaders in digital health and specifically in digital behavioral health, some of the trends that we're seeing and challenges to really driving a truly inclusive leadership culture within this sector. So enough about our organization. Let me hand it over to introduce our amazing panelists. I'll start first with Dr. Brittany Linton.
Hi. Good morning or afternoon, whenever this is hosted. My name is Dr. Brittany Linton. I am a licensed psychologist at the San Francisco VA, where I am a primary care mental health integration clinic director. And my academic background is I came from the University of Texas at Austin, and then did a lot of flying around the country for various clinical psychology opportunities. But what led me to straddle the digital sphere and the industry and organizational setting is that I had a chance to work with a technology company in Mind Strong Health for an early part of my career before moving back to the VA. Lovely to be here today and talk about both of those worlds.
Great. Welcome, Dr. Linton. And I'll hand it over to Dr. Myra Altman.
Thank you so much and wonderful to be here. So I'm Dr. Myra Altman. I'm a licensed clinical psychologist as well, and currently the VP of Clinical Care at Modern Health, which is a digital mental health platform. My academic background, I did obesity treatment and prevention research in graduate school, got a little bit tired of the pace of change in research, so knew I wanted to do something a little bit different. Moved out to the Bay Area for internship and postdoc, learned about value-based healthcare and kind of took a leap to join a startup. I don't know that I necessarily knew what to expect, but so far it's been a great experience. And one of the things that actually really sold me on the company I'm at is it was a female-founded company, so I was excited to work for female leadership. So really excited for this panel and to be chatting with all of you.
So welcome, Myra. And Dr. Hannah Weisman, over to you.
Thanks, and thanks so much, Claire, for organizing this. I'm Hannah. I'm also a licensed psychologist. I got my PhD at UC Santa Barbara. I currently work as VP of Clinical Operations at SESH, and I'd say my kind of focus in the digital health area is on clinical operations and really bridging clinical quality and business operations as digital health companies scale. So excited to be here, and SESH is also a female-founded company, so excited to talk about themes of women in digital health.
Oh, that's fantastic. Well, wonderful. Welcome to all of you. Why don't we, on that note, kind of go ahead and dive in? I'd love to hear a little bit from each of you about, some of your current observations as women in this field. What are some of the trends that you're seeing in the field as it relates to both women in leadership roles and clinical and scientific leadership, and how that's evolving within the digital health space?
I'm happy to jump in here. So I think there's kind of a couple of big trends that I'm seeing, both of which I'm finding exciting. So the first, I think when I first started at Modern, there was a lot of like, okay, you're a clinician, so you do things in the clinical realm, right? Like what is a provider? How do they work? And as I've worked there and as more clinicians have joined, they've gotten a sense like, oh, there's actually much more breadth of what clinicians and scientists are able to do and bring to various parts of the organization, which has been super exciting. And I'm seeing that trend continue. Like there seems to be much more of a demand for clinical outcomes in the field. And so I think that's driving more of a demand for scientists, for clinicians to be at those organizations, to be at the table so that we are ensuring that it's actually really high quality care and we're demonstrating outcomes. So that's been a really exciting shift, I think, for the clinical side of things. And then I think obviously given kind of the massive focus around the globe on DEI, that's another shift I'm seeing. And I know we're going to talk about challenges in a little bit, but I think there's interest and demand in having diverse voices at the table. I think actually getting to the point where those diverse voices are at the table is where it's becoming, I think, more of a challenge for the field. So I'm excited to talk about that. But those are kind of what I'm seeing as positive shifts in the field recently.
Mm. Yeah, absolutely. I'm curious what others are seeing, or whether it resonates, or whether you're noticing kind of different trends. Hannah, how about for
I can
you at
jump
Sesh?
in. Yeah, I would echo what you were saying, that Myra, that I think because of some of the social justice uprisings over the past year, there's certainly been a growing awareness within digital health companies of the importance of looking at the experience of both women, people of color, and other kind of marginalized identities and their experiences within the company. I think the awareness is growing, but to your point, Myra, I think we're still figuring out whether companies are going to be able to successfully translate that into action and like meaningful inclusivity, and what that will really look like.
Mm-hmm.
And then I'm happy to kind of build upon both of those points. Again, sitting within a more traditional healthcare organization structure, such as the United States VA system, what I'm actually seeing is that we have more emerging roles of technology opening up left and right as we're trying to quickly pivot such a large healthcare national system into the digital domain, especially over the last year of the COVID demands. And because all of these new technology roles are opening up, women are able to step forward and actually step forward and fulfill them. And so I think that we're seeing a little bit of opportunities for greater leadership because of the pandemic, because of national and global crises, and because we need people who are knowledgeable, dedicated, and passionate to fill those seats. We're able to actually see a broader opening than we might have seen traditionally if things had kind of plodded along as they were before. So it's one of the small benefits of what has become such a national call to action.
Absolutely. No, that's a great point around the pace of growth that we're seeing and how that actually, can be a silver lining in the rate at which these opportunities for leadership are really expanding in the field. I know, as all of you know, but not all of our audience members might realize, there was recently a report published from Deerfield Capital. It was picked up by Forbes that looked at board director data from 140 private venture-backed healthcare companies. These were companies that have raised at least $25 million in capital. And they were interested in understanding the gender spread in board of director seats at these companies, and found that in nearly half, so almost 50% of these companies, there was not a single woman on their board of directors. And across that cohort of 140 companies, overall, only about 13% of board seats were held by women. So most of these boards are the only one woman representation, and of those with at least one board member, we see they're more likely to have than more than one. But all of that being said, across the board, this is relatively low gender representation on boards of these healthcare companies, which is potentially one indicator of challenges for women's growth in leadership roles. But I'm curious, from where you're sitting, how do you think about some of those big challenges to women's leadership in digital health? And in that, of course, given our focus, specifically thinking about women as really empowered clinical and strategic leaders in these companies, I'm curious what you see or what you experience that may be still big challenges today. Brittany, why don't we start with you, particularly given that you've kind of seen both sides of this coin.
Sure. And to give a little bit of a peek behind the curtain for our audience members today, one of the interesting things that happened is that we were talking about these statistics ahead of time. We were talking about how do we want to collectively address these challenges. And one of the things we came up with is that even in discussing this, there was a range of reactions, right? To, on one hand, my reaction to hearing those figures around female representation and women identified representation on board seats is one of being appalled. Are you kidding me? It is only not even 50% is actually fully represented. And then other members of our panel, right, were like, wow, that's actually an accomplishment and a stride forward. And I think that this speaks to all of the difficulties that women identified people have in navigating the tech space, right? In addition to that, we were discussing how do we talk about some of the difficulties and challenges we have encountered in a transparent and authentic way to actually name, label, and address those challenges in an effective strategy and navigate those pitfalls. it's hard when there are so few of us being represented within the tech field overall, when there's even fewer of us being represented in the behavioral health space, and when there's such a limited number of clinicians who can effectively operate, especially in someone like Hannah or Myra's role, right, where they're actually in operation settings, where there's so few of us at the table, even in women-founded companies, it makes it really, really difficult for us to figure out how do we continue to take steps forward? How do we center the narrative in ways that are not only productive and proactive for the companies that we serve, but our consumer base? And then how do we do all of that while maintaining our professional credibility and making sure we can get hired for the next job? So when we want to talk about the challenges we're encountering, we see those challenges. Again, I'm at the VA right now. I see those challenges every day. Those have been baked into a bureaucratic system. No offense to the VA, but they've been baked into a bureaucratic system for generations now. What's interesting about the tech sphere, right, is that this is supposed to be the innovative cutting edge opportunity. This is supposed to be where we shake things up and disrupt. And yet we still encounter those barriers. We still encounter those difficulties. We still encounter the undermining of our potential and capabilities and influence. And so what I like to see is that I see these transformative women on this panel around me, right? And I know that we are showing up, we are making committed voices, and we're making committed change. But the challenge is there, and it's coming together in centers and pockets like this where we can really have the conversation and really think about what is the strategy. But I just want to speak from a larger standpoint of that 30,000 foot view. This conversation hasn't changed. It doesn't matter if you're in a traditional organizational healthcare setting or if you're in the tech innovation space. The problems for women identified, innovative leaders, and clinicians in particular trying to insert their voices into these spaces is hard. But I'm glad to have colleagues that I respect in this process.
Oh my gosh. I wish we were in person so we could do standing ovation. That resonates so much. Before we continue, I want to hear everyone's thoughts on that topic, but I also want to pause for a moment and welcome Dr. Heather Cole-Lewis to our panel. Hi, welcome. We had and I actually kind of love this because this is our reality. We're living this virtual life, and we're, I think being flexible is wonderful. So let's pause, let's revisit our intros and bring you onto the panel. Dr. Cole-Lewis, we had kicked off initially with just, kind of brief introductions around our background, current role in digital health. So I'd love to give you a moment to tell us a little bit about your story and your current role.
Thank you so much for having me. And I do apologize. In this world that we are living in, schedules are completely unpredictable and out of our control at times. So I do appreciate your patience with me. I am Heather Cole-Lewis, Director of Behavior Science at Johnson & Johnson. My background is behavioral science, of course, but then I also studied chronic disease epidemiology and biomedical informatics. And so the work that I do is really around building health interventions that reach large numbers of people. And of course, the best way I've found to do that is through digital technology, but at its core, really focusing on the real principles of understanding people in their context, in their real lives, bringing the best evidence-based science that we've got, and then also trying our best to incorporate lived experiences into those actual interventions, whatever they might be, and then of course measuring them to understand if they're working, for whom they're working, and for the folks that they're not working for, figuring out how do we refine that, how do we improve it, how do we optimize and get it to the best state possible. So thank you so much for allowing me to join, and I appreciate your patience.
Absolutely. No, I'm thrilled to be able to have you on the panel. We were just chatting a little bit, and obviously, you were able to hear Brittany's comments, but we had moved into talking a bit about what are we noticing in terms of challenges to truly driving towards equal representation in leadership in digital health. And I'd love to actually, Myra, ask you from where you're sitting, and particularly, in a really hot part of digital mental health today, which is the employer mental health benefits space. What are you seeing, or what are you noticing as big challenges?
Yeah, I mean, I will say I just resonated with everything Brittany said. I think there's just all these extra challenges of I was the first clinician in modern health. So you're having to really prove what is it that a clinician can bring to the table. And so, I've been here for 3 years now. We've grown immensely. We now have a team of clinicians, but I feel there's still a lot of work to say, actually, we should be at this table. We should be in this conversation. Like, let's make sure that clinical voice is represented. And now that I'm in a leadership position, I feel an immense responsibility and also like passion and commitment for making sure that we have diverse representation, we have inclusion when it comes to clinical leaders. And I feel like before I was in a position to hire folks, I would have said, it's a total cop-out to say that there's a pipeline issue, right? Like that it's hard to find diverse leaders, diverse women to join a digital mental health company. And now I'm in the position of hiring, and it's really hard, right? It's really hard to fill those roles. And so I think that's been really fascinating for me to grapple with. When I think about who I want to be as a leader, it's like, I want to live the things I value. And then you run up against like actual challenges to do that. And so I think there just has to be this ongoing conversation. And the more that we have clinicians and diverse clinicians joining these digital health companies, and the more there's this pathway and there's the more the pipeline, like, okay, I can see that there are women in leadership, or I can see that there are BIPOC women in leadership, like, okay, maybe I can do that too. And we just create then more opportunities. I think what I'm seeing too is there's often like modern health is growing super quickly. So when we're thinking of hiring, there's often like well, we should hire someone who's worked in tech before so they can get up to speed quickly. And I'm always like, well, then we're going to have the same 50 people moving around to every tech company. Like we have to have that first step in where someone can have a first role in. So we try to really not look at that as much and say, who's excited about this? Who's, who wants to join this sort of crazy startup world where things are moving quickly, and not have that be so much of a barrier. But I think there's like a million things like that we all should be thinking about. I'm sure there's things I'm not thinking about that I should be more.
I think there's something you shared there that stuck with me of around how do I now, as a white woman in leadership, create, really show up as an ally in creating spaces that are going to be inclusive for women of color. One thing that I've noticed in terms of a specific dynamic that can make it difficult for any woman to succeed in the workplace are communication norms. I have often found the communication norm in various settings that I've worked in to be very, what I would describe as a male dominant style of communication. And I have adapted to that. And that's something I think I've observed myself really try to be more like that so that I can have a seat at the table. But then I reflect on the fact that by doing that, I'm basically reinforcing that culture instead of shifting the culture and making room for people who have different communication styles and, both across gender, but also across cultures and identities. And so I think that's one thing, that I reflect on, I think is a challenge, but also an opportunity, is how do we not reinforce a culture, but actually shift it to make it a more inclusive space for women, and particularly women of color.
100%.
Yeah, that so resonates. We've been having these conversations internally. We did some leadership strengths assessment, and we were looking at the dimensions of warmth and strength. And we have a primarily female leadership team, but even the men leadership team were like all super high on warmth. And so it was this really fascinating conversation of how do we dial up the strength without dialing down the warmth? Like, can you do both? And can we be more clear, more direct, but not lose kind of that kindness, that warmth, that support? And that really resonates with me. And I feel like it's really hard to strike that balance, particularly as women. Like, I definitely notice that dynamic where I'm like, I'm saying things a little bit differently, or I have to self-monitor so much more than potentially a male colleague might have to because of those perceptions.
Mm-hmm. I'm curious, well, I feel like we could talk about this for hours, but we will be mindful of everyone's time. One thing, I think it's really important to shine a light on what these challenges are, what the experiences are that each of us are having as women in the field. But I also would love to hear, as we look forward, what are some of your recommendations, things that we really can do as a field that will, I think, lead to positive change in terms of driving for more inclusive leadership? So I'd love to hear from each of you really what some of those top areas of opportunity are, or even specific recommendations that you have for people who are in the field, which, the audience at this conference is largely, folks who are actually in a position to make some of these changes. So I'm curious, what comes to mind for each of you as those important areas of opportunity, or action steps that we could take as a field to drive towards a future where we see more representation and leadership across the board in digital health?
The first thing I would say is, and someone already mentioned this earlier, but really creating the space for understanding what leadership is going to look like. I think for a long time, we have existed within structures where expertise is defined by a particular rubric that we are all really starting to be able to question pretty openly now. And so what that means is that expertise and years of experience and all of those types of things might look a little bit different. And so I think as long as we continue to create the space for understanding leadership in various forms, and we put value, again, we have to put value on these things in order to allow people the ability to move up. So we have to look at even our rating systems and how we're rating people and their performance over year over year. We might need to go back and reassess some of that and say, well, maybe we were looking at this in the wrong lens, right? When we talk about leadership. So I think creating the space to understand and redefine expertise and skills is important. And I also think another thing is just being very transparent about the barriers and challenges that people are facing in order to show up and be the type of leader that they need to be, and just respecting that and respecting where they're coming from in doing that. And so sometimes that means that we are going to have to, again, think differently. We just have to continue to think differently and be open and create the space for those new ideas. And the very last thing I think is it's really important to create those training programs that will also make sure that that next generation of leaders coming behind us who have figured out a way to break through also has the equal playing field as other people.
I'd love to jump in after Dr. Heather, because that was what comes top of mind for me. So right now within the VA system, I serve as a clinical educator. I am helping run clinical behavioral health programs and really train the next generation. And when we started out this past clinical training year, and we were starting completely remote for many of our training learners across medicine, across psychology, across mental health, behavioral health, everyone was starting digitally and remotely. And a lot of them were really saddened that they were not having a traditional internship year or residency year. But when I gave my pep talk at the beginning of the year, I was so happy. We now have a dedicated forced adoption hybrid workforce. This is the first time we've had every single clinical contributor and provider had to do forced adoption of some sort to provide them to be hybrid healthcare providers. That is amazing. We have a new pipeline building. Again, this is a silver lining. We have a new pipeline building, but how do we continue to uphold that, make it sustainable, and really welcome more people into that fold? So what my best recommendation is as whether you are a woman-identified leader, whether you are a BIPOC leader, whatever your leadership style is, and even if you're not holding one of those spaces, but you want to see inclusivity in your field, you want to see a greater generational change, not dependent upon age, that you really make sure that you are incorporating the opportunities for internships, for exposures, as Dr. Myra is saying, allowing for people, regardless of their experiential background, and Dr. Heather was saying, letting them step into the fold, but encouraging that to happen and making yourself available and championing this idea that we now have a workforce that has forced adoption thrust upon them. That's really great because behavioral health, I'm a primary care psychologist. Behavioral health has been the lagging healthcare provider field to really move into digital domains and telemedicine and telehealth or any forced technology adoption. Finally, behavioral health clinicians are understanding the benefits that many of our primary care and specialty medicine clinicians have understood over other periods of time. Doesn't mean it's a perfect system. I am not arguing that. We have a long way to go to make telehealth therapies effective and promotional for every consumer and make them inclusive for every consumer. But we're getting there when we actually step up to the plate as providers ourselves and we train our future generations.
Yeah, I couldn't agree more once again. And I think what resonated for me there, Brittany, Dr. Brittany, that also sparked a thought for me was things have just changed so much during COVID-19, right? Like, and so many of those changes have been awful. They've been awful for women dropping out of the workforce in a lot of ways, but is there also an opportunity for us to start to do things differently, right? So like in my workplace, one of my coworkers has a young kid. There are meetings where her son is just on her lap and it's wonderful. Like everybody loves it. Everyone's day is immediately made better. like that was sort of a forced thing. We had to acknowledge that people are these whole people and they have things going on. And so I think it's like, how do we get people in the door? And then how do we create a different circumstance when they're there, when that's okay? And I think like I've chatted to her about it. I'm like, I think it's actually like a very brave move that she did, right? She was just like, I'm just going to bring my kid. I'm going to say on my calendar when I'm pumping. Like, this is just a reality and this is just a norm. And I think it's sometimes scary to step into those spaces and those ways of saying like, yeah, we're going to do things a little different. And for me as a leader, I think like, I need to take those risks more and model that like, yep, we're going to do this a slightly different way. And that might mean stepping outside of our comfort zone. So where are places that clinicians or women in leadership aren't typically represented, and can we have a seat at the table? Like, I get super involved in sales. Do I have any sales training? Absolutely not, but that's an important part of a startup, right? That's the revenue generating arm. So how can we show, hey, clinicians, women have a voice here too, like that speaks a different language, or these different parts that maybe we don't know how to stretch into that area, or we don't necessarily have training or experience, but we have a lot of skills as clinicians that are really flexible and adaptable to all these different domains. And can we just start to do that more? And I think what's exciting about the digital mental health field is it's so young that it's not like, there's not necessarily a road, like a pathway clearly defined of this is how you do this is how you do that. We kind of have to try by trial and error. And so I think the more we put ourselves out there, the more there's a pathway for others to do the same.
I will just build on what all three of you have shared. I think you touched on this indirectly, but I want to add, it would be remiss of us not to talk about parental leave policies and how that impacts women in particular. And during COVID, we've just seen a huge dropout of women in the workplace and not coming back, because it just, even though all these cultural shifts have occurred, there's still just not enough support. And I think not waiting to put that parental leave policy in place. So even for startups, thinking about this early on of how are we going to support women and hopefully any parent who is bringing a baby or a child into their life and making that explicit, right? So it's not kind of this unknown, like, is that going to be okay? But making it very clear how that can be okay. So that's one very concrete thing. And then I think the one other thing that comes to mind for me, and this relates to what I shared earlier, is for women who are in leadership positions, really challenging ourselves to think through, how can I shift these norms instead of reinforcing them or adapting to them, but really being able to name them, talk about them. I loved your point, Dr. Cole-Lewis, about having conversations about leadership and the values and what do we want that to look like, so that you can have that be out in the open and consciously shape those instead of unconsciously reinforcing norms that aren't helpful to women.
All of those recommendations are so well taken, and I think give me so much hope and energy around really the future that's possible to create in this space. I want to thank each of you for taking the time to join us on this panel, to share your thoughts. And also just want to invite anyone in the audience who's a woman with a clinical and or scientific healthcare background. WELL really exists. Our hope is that it exists to serve the purposes that each of you just named, right? To create a space where women see themselves represented in leadership in this industry, where we actually have an opportunity to share skills and techniques and resources and support that actually help us each to grow into more thoughtful, inclusive, strategic leaders in this space, and to give, really an opportunity to build on all the incredible, training and experiences that women in the field have, and close some of those gaps to make it possible to actually step into those leadership positions, and then, reach out and bring another woman with us into a leadership role. And so I would really invite anyone out in the audience to reach out, to myself, to anyone on our WELL panel, to learn more about our community, the events that we hold, and how we connect as peers in the space. And again, just want to thank each of you for taking the time to speak today. I know I learned a lot and feel very inspired now, and I look forward to continuing the conversation.
So great to chat with you all.
Thank you.